Okay, so we know about dental hypersensitivity. You see it every day. Do you think your symptoms in the past have been, the symptoms have been adequately relieved? Are most of your patients happy? Yes, no? Bit sometimes. I'm not saying that BioMin, but in the past, do you have the tools to be able to do this? But would they really like a more effective alternative? Yeah? Would you all agree? Nods. Thank you. So why is BioMin F different? I wanted to explain what is different about this technology. And really it's the first toothpaste that can produce fluorapatite ongoing for up to 12 hours. I'd say that's the fundamental change that this research has developed. It's the only product to provide low-level fluoride for elongated periods. So what we're able to do is to control the delivery of fluoride. And I think if we look at one aspect of this product, that's really what it's doing. It's able to regulate the fluoride, so you get the fluoride when and for as long as you want it, together with the calcium and phosphate. And I think that's really critical, because unless you get calcium and phosphate, you're not being able to produce the minerals. So it's the combination of the three ions that's so important. And I think why is BioMin, that many of you are using BioMin, why you're getting success, is because the tubules are being occluded with fluorapatite, which is a lot more acid resistant than other tubular occlusion types of sensitivity toothpaste. You've really got the choice of potassium nitrate to deactivate the nerve, but it doesn't actually solve the root cause of the problem, which is the open tubules. But all of the other toothpaste you have available today do not produce a fluorapatite plug, and so consequently are not as strongly resistant to acid, and that's why perhaps not all of your patients have always had the desensitizing aspects of the toothpaste. So how does it work? This is just an easy schematic. So when you brush your teeth with BioMin, these very small particles that contain the calcium, phosphate and fluoride, they adhere chemically to the enamel surface. So we have this bridging polymer, very, very similar to how a glass ionomer would work in the mouth. So we have this, we have a very strong bond, and throughout the next 12 hours, this will continue even after eating to stay on the tooth surface. And so then what happens is the saliva is able to slowly break down the particle, releasing the calcium, the phosphate and the fluoride. So really this green ball here of BioMin, it is really a reservoir of minerals that are then released over the next 12 hours. So then what, oops, go back one. So this is a schematic of looking at the cross-section of the tubule, and the fluorapatite, the calcium, the fluoride and the phosphate come out of the glass and they precipitate onto the tooth surface, and particularly in areas of nucleation sites. So round the neck of an open tubule is where you'll get a high level of fluorapatite being developed. So what it ends up happening is your tubule is going to become smaller, and the diameter of the tubule will decrease, and because it decreases, it lowers the fluid flow, and hence the sensitivity onto the aspect of the transmission of hot and cold to the nerve. So the smaller we get the tubule, the better. And this is much better than, say, using hydroxyapatite type toothpaste, which are really like putting stones into a hole. They don't actually have this this coating of the tubule. Really, you're just getting a physical occlusion or semi-occlusion of like pebbles into a hole. You've still got lots of gaps. So what this is doing is creating an integral part sleeve around the neck of the tubule, and this reduces then the transmission of hot and cold. So this shows you an SEM. You've got on the right, on your left-hand side, the before brushing. So this is a prepared dentine surface. We then look at brushing with BioMin F toothpaste for 1 minute, and then putting it into an artificial saliva solution for 1 hour. And what you'll see is exactly what you saw in the schematic. Around the neck, the tubule is becoming much smaller, and also you're getting deposits of fluorapatite all around the neck of the tube. So it's reducing the diameter. And then you can see the bioactive glass on the tooth surface, and also going sometimes occluding, because we've got very fine particles. We've tried to match the size of our particles to the tubule as well. So we're getting this physical occlusion as well as the chemical deposition or precipitation on the tubule. So this is probably what differentiates BioMin from all others. It's what happens when you put it under acid challenge, and you can see the tubular occlusion on the left-hand side and the right-hand side are very, very similar. So even after we've got citric acid challenge, it's cleaned the surface of the dentine off. You've got the bioactive glasses being washed away. But if you actually look at the tubules themselves, they're at least as well occluded as they were in the first place. So this is shown that we have very little change in the fluid flow before and after acid challenge. So if you compare with other sensitivity toothpaste, on the left-hand side we've got BioMin, which gives you a tubular occlusion. This is a laboratory test. Obviously it's much more difficult to do in the mouth, but this is just to give you a show in the laboratory that we've got a very, very high level of tubular occlusion. BioMin, which I imagine you all know as Sensodyne Repair and Protect, an excellent product, is not bad. Very similar to Colgate Pro Relief, but the Colgate Pro Relief will not have the acid resistance of the fluorapatite. It tends to give it has a calcium carbonate plugging rather than the fluorapatite plugging. Then you look at the nanohydroxyapatites. I don't know if any of you use nanohydroxyapatites? No? Yes, no? No? No, okay. They're used, but they're not quite so effective. But then after acid challenge, the BioMin would stay where it is, and most of the others will drop. Yeah. So that's really how it works how it works in the lab. What about the clinical results? And this really, I think, is the acid test, because you can do all the studies you like in the laboratory. It's what you see happens with patients. And what we did before we launched the product in 2016, we got just under 200 patients with sensitivity and tested how this product helped them. And we found that around about 65% within 2 weeks had a significant benefit in the reduction of the sensitivity. I'll be honest, I won't claim that this will work for every patient, but it is significantly improved. These would all be using sensitivity toothpaste before, so it's really from that the improvement. The majority are finding significant improvement, and some completely symptom-free within 2 weeks. And so that was back in when we started with a very early first trial batch of the product, and we did a similar sort of study this year in Milan with some Italian dentists. And you'll see here that BioMin was, they were all using, these were done by 2 dentists who had a large number of patients who they'd had continuous issues of sensitivity. They were using every product under the sun, and they wanted to see how did it work for there. So if we go on the right, I wish I'd made this a bit bigger, because even my eyesight's a bit challenge. But we're looking at that on the sensitivity side, that we had a high percentage of 27% completely subsided within 2 weeks, and significantly increased was considerably decreased was 52. So in total, around about 4 out of 5 found this product to be of great benefit. And the majority again found that BioMin was more successful for them than other sensitivity toothpaste. So again, showing that this gives a good overall benefit. So these are, besides the sensitivity reduction, The other benefits are the resistance to acid attack. You're getting a fluorapatite surface throughout the over the teeth. Professor Hill will go into this in much greater detail tomorrow afternoon. And also the remineralization of early lesions. So what you saw was happening in the tubule would also happen in early lesions like white spot lesions as well. And we're starting to show, our studies show that we're getting round about 250 micron subsurface remineralization. So it's not just at surface level, and that's the problem with high level fluoride toothpaste. You get good surface level remineralization, but you don't get subsurface, and that's why after white spot lesions they don't necessarily go away after high level fluoride. And I think there's a poster downstairs, I don't know whether you've read it, that compares tooth mousse with high level fluorides, and that was showing exactly the same. Okay. So I guess, do you all have patients that refuse to use fluoride? Mm-hmm. Yes? Everyone? Yeah, it's unfortunately a fact of life. There's a lot of misinformation about fluoride and about fluoride levels. To counter that, we have another product, the BioMin C. What we've done here is, in the glass structure, we've substituted the fluoride with chloride, and this will produce hydroxyapatite on the tooth surface. So it will do exactly the same, but it won't give you the acid resistance of the fluorapatite. So if you have patients that have sensitivity but refuse to use a fluoride toothpaste, what would you choose today? Well, maybe today you'd choose this, but what would you choose yesterday? Chosen yesterday? Yeah, a bit of a challenge, I guess. Yeah? What would you recommend? Be sensible. Pardon?
They normally tell us which one they're buying.
Yeah, and are they happy? Yes, okay. And they won't do anything about their sensitivity whatsoever. Anyhow, so the takeaway today, if you have for those patients, there's no point in arguing, you won't convince them. This product is a very good option for them. This will create hydroxyapatite in the tubules exactly the same way as I've shown in the previous images, and is an option for them. And also, if you have somebody suffering from acid erosion as well, this will help to be able to remineralize the tooth surfaces. So with these two products, you have an armory of armamentarium to deal with sensitivity. Okay. Just wanted to run through a couple of points. I'm sure that you all agree with most of these. Where we recommend brushing, to get the best use of brushing before breakfast and last thing at night. Do you all recommend that? Anyone not? Yeah? Good. And medium to soft brush, I guess that's also quite standard. Brushing for 2 minutes. What we do then say is to get the best use of the BioMin is to be able to swirl this around a bit like a mouthwash. This creates greater adhesion of the BioMin particles to the tooth surface, which is what you require. So then to spit out, and as with all toothpaste, do not rinse after brushing. Are you all non-rinsers? Wow. It's the first group I've ever talked to where everyone's universal on that. So I normally get, especially from dentist groups, I get strange looks. You say, why to do that? However, I think those that have used BioMin will find that the taste of the toothpaste is relatively mild. We've done that for a reason, because if you have a very high, a very, very strong flavour, it encourages rinsing. So we really would say to get the best of this product, don't rinse, and ideally not to eat for the next, eat or drink for the next 15 minutes. So the longer the better. Yeah. Okay, so I know that a number of you have used the product. Have any of you any questions about what I've mentioned, or any questions about the product in general? Yes, please. Is it
widely available, or is it going to be mass marketed, or is it only available through dental surgeries?
Our objective was to get it established with the dental profession. So it's available through TRICARE to dental practices. There's also, it allows the practice to make a profit if it so wishes on the product. and also to supply it online as well. So it's available on Amazon. It's also available on TRICARE's consumer site, which is called Upbeat Care. And that is our policy going forward. We do not see this being put into high street retail, certainly not into the likes of Safeways or Tesco's, and even Boots. It's for a small startup company a very, very difficult way to go. I could elaborate that outside of this, but so basically we're looking at it to be marketed through the profession. If your practices don't wish to take the product away, then I would recommend that you refer them to Amazon or to Upbeat Care. We will have a patient brochure for you that I think we may have many of your. If you come to the stand, give us your email addresses. We'll make sure that you're kept up to date, and also have a patient brochure that you can then give them if you're not able to sell the product in the practice. Yes?
Does it have SLS in it?
Yes, it does have SLS. I would wish it didn't, but I also want to explain a little bit more and give you an advice on SLS. In order to make a toothpaste function and to foam and to clean, you need to put a surfactant in there. SLS has got is a well-known product. The reason it's being used widely is because it doesn't taste and it doesn't affect, and it's very efficient as a foaming agent. However, by changing to another foaming agent, you don't necessarily solve the problem. So we're doing a lot of work to look at what alternatives we could use, but there's no point in just changing. There are surfactants out there that are worse than SLS. So be very careful if you move somebody away from one to another toothpaste, that the surfactant is actually less aggressive. Surfactants by their very nature are going to be aggressive to soft tissue, and some people with high levels of sensitivity to that can react to that. SLS there's a lot talked about SLS, but there are other things out there that are equally or not more damaging in that respect.
Do you need the surfactant?
Yes. You need the surfactant. Is what it does. It helps clean the tooth. It helps clean the tooth and the mouth. So it foams. If you didn't have the surfactant, you wouldn't get this foaming effect, and the sensation would be very, very different, and it would tend to be more sticky as well. So the surfactant has a very important role to play in the cleaning function. Surfactants are used in all cleaners. It's the way in which you raise organic matter off a surface. So it's not what we are coming out with in the new year is a professional gel application that will be SLS free, and will be really for post-scaling sensitivity, and also for those that have a high level of sensitivity to SLS. This could be a product they could use. Yeah? So I imagine we hope to get that through regulatory approval by about April next year, but we'll keep you informed about that. So that means you'll have a product for in-office, or rather in the practice, and then the toothpaste for home care. Yeah? I hope that answers your question. Yeah. Yes?
Can you use it during bleaching?
Yes, actually it's very effective for that. There are many dentists or many practices are using it, and when they take the impression to manufacture the gel tray, they get the patients to start to use BioMin toothpaste, BioMin F toothpaste in the run-up to the first application in practice, and I've had comments back that sensitivity reduction is almost 100% sensitivity reduction. From what I understand, you may be able to tell me otherwise, that probably 15 to 20% of patients do suffer significant sensitivity during bleaching. And I know some of the Philips representatives are actually advising some of their practices to with Zoom to use BioMin as a precursor, and also during the course of treatment. And that's one way that you can make sure that you have that you get that the course of treatment is fulfilled. And it's also a way to keep people to use bleach more regularly if that's what they want to use. Yeah? I don't know if there's anyone used it for that, by the way? No? No? What you could also find is post-scaling, also quite a good application. It's at the moment an off-label one, but I know a number of hygienists that are using this. If they're removing high levels of calculus and you've got exposed dentine tubules, you're going to have quite a high level of sensitivity. To apply BioMin at that stage is quite useful post-scaling.
Sorry, when you say post-scaling, would you just do it in the surgery, or would you get the patient to use it post-op?
Well, both. What I would suggest you do is you do it immediately post-scaling, and then you get them to use BioMin in a normal way. You could get them to use it topically as well as with a brush. Yeah.
So you can just rub it on.
Yeah, you could rub it on. Yeah. In fact, if you had somebody with high level of sensitivity, it's not a bad thing to advise them, say after lunch, to be able to just apply some on the sensitivity areas, or if they've had a drink or something or other, acid drink, to do that, to use that. Just yeah. So.
I was just going to say about Pro Relief prior to using Cavitron.
Yeah.
Giving them a polish, that works very well with some patients. And did you mean pro and actually you could do both, pre and post. Yeah, pre is not a bad idea. It's probably an alternative to having to use a local if you have I think can be used that way. A lot of patients insist on
yeah, yes, yeah. So it would, by all means, I have to say it's off-label. It's not a recommended use, but that's really why we're coming out with the Pro Gel. Is going to be indicated for that.
That's going to be for.
Yes. The viscosity will be slightly higher,
right,
and it'll be stickier, so that it adheres better. But at the moment, BioMin would work reasonably well for that purpose. But the new product will be even better. Yes, correct. Question?
You've asked.
Yeah. Any others? If you haven't got samples already of BioMin and you'd like to try some, come down. We've got some on the stand. If not, thank you very much indeed for being attentive audience. I hope you found this interesting, and I hope you're able to make your patients' lives happier.